Good afternoon and welcome to the AV Digital Desk. I'm your host, Sarah Good. Today we're speaking about prostate cancer. It's Prostate Cancer Awareness Month, and Riverside Health is joining us to talk about free screenings they're offering this month, as well as what to be aware of. Now, 1 in 8 men will have or be diagnosed with prostate cancer in their lifetime, so this is something that affects a lot of our population and here in Hampton Roads. So I'm going to bring on our guest from Riverside Health to talk about it and to answer your top questions. Good afternoon. Thank you both for joining us today.
Thank you for having us.
Thank you.
Absolutely. To get started, let me just introduce who we have here to talk about prostate cancer today. We have Amanda Norman, a nurse practitioner with your Riverside Urology, and then Marina Moore with Riverside Urology, licensed practical nurse. And so, we're just going to talk about what this is. We're going to make it comfortable. If you have questions, please put them in the chat and we can bring those into the conversation if we're not already getting to them. But just to start, Amanda, if you want to start, can you just talk about how maybe pervasive or how big of an issue really prostate cancer is, especially here in Hampton Roads?
Well, prostate cancer is a leading concern for people with prostates. It's the second most common diagnosed cancer in men. And when it's detected early, the prognosis can really be great. Our patients can live normal, happy lives after treatment.
And let's talk about what some of those treatments are. Marina, what the screenings are. So, Marina, can you just talk to me about what happens? What is the starting point for people to be screened for prostate cancer?
So our starting point is at age 50. We would like our men to start getting their prostate exams. We do offer testing called PSA, that is the prostate specific antigen. That is a blood test that is done. We usually do that on a yearly basis, as well as having their digital rectal exams done.
And what have you noticed in terms of having free screenings, getting the community involved? Amanda, in terms of, is it hard to get people to come in for screenings? Is it hard to people do screenings and, make those routine visits?
Well, most people are a little reluctant. Typically, the way that screening or early detection is initiated is that your primary care provider will collect a good family history. They will take into account different factors like family members that were either direct, like a parent or a sibling, as opposed to aunts, uncles, well, not aunts, sorry, uncles, grandparents. And from that, they'll determine when it's appropriate to begin with the annual digital rectal exam and the PSA. If they get a reading that is elevated, or they have a digital rectal exam that is suspicious for pathology, like there are lumps, bumps, indurations in the prostate, then they'll make a referral to Riverside Urology. From there, they'll come here and they'll see us. I think at that point, it becomes really kind of nerve-wracking for a lot of patients, and so they'll tend to delay coming to see us. They're a little hesitant. They're a little fearful, especially if they have family members that encountered prostate cancer. So it's really amazing that we have LPNs like Rena who welcome them in, review their health history, explain to them what to expect, and then kind of get us set off on the right foot. As far as the free screenings go, it's fantastic. It gets lots of people that thought, well, I'm between health insurance, or I haven't established care anywhere, or I don't have a referral from my primary care. So I'm going to get in there and I'm going to try it. And that's really been quite helpful in bringing in people that otherwise would not be screened.
And you mentioned people are scared, maybe to get those screenings, or scared to sort of jump in to get appointments, especially if they've had loved ones go through, maybe this diagnosis. Marina, what have you noticed when people come in? What's it like? I mean, how do you make them comfortable to, maybe get screened or maybe go through this process?
So I start off telling them we're all afraid of the unknown. My job when they come here is to educate them. So if I educate them and let them know what the step of each process is going to be, it makes it a lot easier. So when they do come in, I greet them, I introduce myself, let them know you were referred for elevated PSA. I explain to them what the elevated PSA is, what their number is, and how we're going to proceed forward. The next question I tend to ask them is, have you ever had a digital rectal exam? Most times their eyes get really big and they get that look, and it's like, wait, just hear me out. I'll explain to them that it's an exam to check your prostate to see if there's any abnormalities. Is it large? Is there anything that's abnormal about your prostate? And I let them know Amanda will do that procedure. But if you need someone in the room, I'm more than willing to come in and stand aside. That way I will talk you through the exam, because my job is to make them comfortable. I want them to know that they can trust us and that them depending on us is going to be a great outcome.
And oh, sorry, go ahead.
Oh, absolutely. Rena has given so many of our patients comfort. There's an example I'd like to share about a patient that was here for an unrelated issue. And while he was here, Rena had done his intake, and she said to me, yes, he has PSA values. He's under the age of 65. His PSA values are not elevated. I think it was under 1.3. And, but he told me that he hasn't had a DRE ever. And so I said, okay, well, we're going to discuss his reason why he came. And then I'm going to encourage him to have that digital rectal exam so that we can really have a good pre-screening or a good indication of what his risks look like. So he was very reluctant. He said, I've been told that you don't need to have a digital rectal exam if your PSA is fine. But Rena talked to him, and then she invited me back to the room. She said he's changed his mind. He wants to have the digital rectal exam. Well, thank goodness, because on palpation, we did notice, or I did palpate a lesion. So that was disheartening. But, there's always hope that maybe it's just a prostate stone or something. So we sent him off for an MRI of his prostate. The radiologist sent the results back. It was what we call a PIRADS 4, so highly suspicious for prostate cancer. So then we referred him to our surgeon, Dr. Burgess, who took a look at his radiology report and said, okay, he needs to have a biopsy of his prostate. So it was done here in the office expeditiously. And unfortunately, he did have prostate cancer. It was a Gleason 9. So the most aggressive is a 10. So a 9 is highly concerning for metastasis to other organs, bones, etc. So with quick treatment and intervention, he's doing very well. I'm glad to report that he's recovering and a really great outcome. But had he not had the digital rectal exam, we would not have detected prostate cancer, and this could be a really sad story.
And is that something that's a common tale? People are nervous about coming in. They're coming in and maybe end up on that higher spectrum of, maybe it could have been caught earlier. I mean, is this a common story for people to be afraid of coming in and to have that test?
It was for a while. When I first arrived here, plenty of the patients, this is an older male population. They were really uncomfortable with the idea. We have a lot of veteran patients here, so they connected with Rena because she served in the military.
Yes.
And so they got a lot of confidence from her, and then they said, okay, all right, I've told everybody no for years, but fine. If Rena says I need it, I'll have it done. And a lot of people have had better outcomes because of it. And in other cases, sadly, we have found that people could have been treated much, much sooner. So, yeah.
And I was surprised, just to see the numbers of what's expected from the American Cancer Society for 2024. I think it's almost about 300,000 cases, new cases of prostate cancer in the year, and then about 35,000 deaths. I think those are really staggering statistics to hear. Are you seeing those numbers in the office? What are you seeing, Marina?
We do see those numbers in the office. So what our job is, we have to encourage our patients to encourage their loved ones to come and get their exams done. Because what we do know, in African American men, the rate is higher for prostate cancer. And then like in cases, 6 out of 10 cases, those men that are diagnosed with prostate cancer are 65 or older. Younger men, 40 and under, it's very rare in them, but that does increase at age 50. It's that increases for the prostate cancer. So it goes to educating. We have to educate our men. It doesn't matter what your race is, we have to get you educated. You need to go get your blood work done and follow up. I know that you're afraid, but follow up. There's no wrong answer. You can't complete something or fight it if you don't know what the answer is to it. And that's what I'm here to do, to help educate and be that advocate for them, to let them know, hey, it's going to be okay. We'll walk this walk with you if you allow us to.
And it sounds like, at least at your practice, you all really are invested in their process from coming into the doors and getting screened through leading them through this process of getting help if they were to be diagnosed. How does that feel once, a patient sort of is welcome and open to getting a screening? Do you hope they bring that message back to maybe either their community or their family or their loved ones?
Absolutely.
Yes, it's awesome because we actually had a patient today that came in and he was so excited. He's like, you all saved my life. There's no better feeling than having a patient come back that has been diagnosed with prostate cancer and tell you thank you. So that's the best feeling ever. And we all have men in our lives that we love, our dads, our grandpas, our brothers, our uncles. Just encourage them, let them know it's okay, but we have to get a diagnosis in order to be able to have a future with you.
And, in terms of screenings, there's blood tests, there's the digital rectal exams, there's different screening tools, and it seems like there's different screening tools for various types of cancers that have sort of grown in the last few years too. I mean, how do you feel, Amanda, if you want to take this one, about what screening tools best, when to get started? How do you sort of navigate that? Is that something that they talk about with you all, or start asking questions?
So typically screening is initiated by the primary care provider. So for the average risk male patient at age 50, their primary care would begin to order an annual PSA and would begin an annual digital rectal exam. Now, if they're age 45 and they're at high risk for developing prostate cancer, maybe they had a first relative with it, or they're African American, then that would be the right time. And even can be as early as 40 if they are African American and have a direct blood relative or two that have had prostate cancer. So since so many people will be screened, but only so many will actually have the disease, we kind of wait until they have an unusually high PSA or a suspicious DRE, and at that point they're referred to urology.
And what are those symptoms maybe that the primary care notices? Do those vary based on patient, or can you catch some of the symptoms earlier that might, point to having prostate cancer?
There are no symptoms, none. So until it gets really advanced. And so yes, as far as early detection, the best screening tool is the PSA and the digital rectal exam.
Do they have confusion about that? Do they say, "Oh, I feel fine"? How is it possible for me to have prostate cancer?
Absolutely. Oh my goodness, we have had so many that come in and say, this isn't possible. I don't have any family history of this. I am peeing with no difficulty. I don't feel sick. And you want to remove my prostate, or you want me to have radiation? Like, how is this even possible? And it can be challenging, but because we have a specific order of PSA, DRE, send for MRI of the prostate, then biopsy the prostate. We followed this plan, and then we hope that will translate, that confidence that we have in our plan will translate to confidence from the patients.
And, the free screenings, I imagine, this is bringing in people who might not otherwise, maybe this is their awareness piece, or people that might be, discouraged or not feel comfortable going to the doctor. Can you just tell me, Marina, you want to tell me a little bit about, the free screening events that are coming up this month?
Yes, ma'am. So they can go to riversideonline.com. This will give them a list of free screening events, locations, and times, as well as they can speak with their PCP. Usually there's literature out at the hospital where it's posted up in it to let them know prostate exams or free prostate testing is coming up. Be aware that this date and time is available, but definitely use the online services. Riversideonline.com will give them all the information they need to know.
Great. And for anyone watching on YouTube or Facebook, that link is already up and it's, posted with a flyer of the dates. I just want to real quick say, this first one, September 9th, that's coming up, that's going to be on the Eastern Shore. So these events are spread out, throughout the Hampton Roads area, which is great. So you're really opening it up to different communities. When people go and they go to these free screenings, are you hoping to catch who are you hoping to catch? I know that we sort of talked about it, but are you hoping that this brings people in that might be otherwise scared, or this might just be that one appointment that works for them, that time slot? What are you all hoping to get by these free screenings?
Well, since referral to urology is really how you arrive here and you meet us, we are hoping that people who don't have access to a primary care and to receive that referral, those people would come to this event or one of these events and get in front of us and have the blood work done and then the digital rectal exam. And from there, we may be able to catch that group that doesn't have a general practitioner that's just watching over for their entire health.
And Marina, what are you hoping for, on your end? Like, what have you seen? Have you seen people from, past community events or just from coming in the office? Are people getting more comfortable? Do you think that these events are necessary to bring in, new people?
Yes, I do. I do think are very necessary because it brings in new people, word of mouth. And the best thing is sometimes you see people that you've seen in the clinic. I've seen them at stores, malls, gas stations. So our hope is that it brings in the people, let them know there's nothing to be afraid of. We're here with you. We're here to support you, and we're going to be here.
And, Amanda, just to finish off here, for Awareness Month, for you, how important is it to have these conversations, to talk about it, even though maybe some of the terminology is uncomfortable to people, maybe talking about some of the exams is uncomfortable to people? How important is that awareness piece really, in such a high diagnosed cancer?
Right. So this really is our front line. This really is our disease with the nefarious intent of spreading to all your bones and all of your organs. This is the cancer that wants to start out small and undetectable and then wants to wreak havoc on your whole life. And we want to stop it.
And Marina, for you, I just, the same question. How important is that awareness piece from people you've seen, maybe other veterans, maybe other people in our Hampton Roads community? How important is that awareness to spread, not just from, going to these appointments, but in the community?
It's very important because the only way we can stop it is by word of mouth and education. So we need them to come out, bring their family members, bring their friends, and be that advocate for a family member or friend. Because you never know, it could be a general conversation that you're having with your next door neighbor that would trigger them to come into the office and say, hey, I was talking to a friend about this. I'm having these same concerns. I didn't address it with him, but I'm here. And that's how their primary care doctor is going to get that referral to us. And then we'll take it from there because it takes a group of us to keep those patients well.
Absolutely. Well, thank you both so much for talking to me today and, giving really the community another opportunity to sort of learn about maybe they didn't know, honestly, maybe some people here today didn't know exactly what the order of operations was about the free screening. So thank you so much for joining us. Is there anything else before we head out that you want people to be aware of?
Just go online, watch those stories. They're very impactful. We saw one of them yesterday.
Yes.
So it's wonderful to see him doing so well, and we're just so delighted that we have the opportunity to help so many.
Absolutely. Well, thank you both again. Just like they said, you know, kind of line on Facebook and YouTube. There's a link over to wavy.com, which will take you to more information from Riverside Health. Find out more about the free screening opportunities happening this month and more information and resources from Riverside Health year round. So thank you both so much. It's been great speaking with you this afternoon.
You're very welcome.
Thank you for having us.
Absolutely. Take care.
Bye.
Bye bye.